So without further ado, I will just give people a little chance to write their questions in the Q&A boxes there. And if we go round and just find out with 30 seconds of who each person is, quick thing about the background, about what most interests them about nursing. So just 30 seconds for each person, starting with Nicola. You've just joined us on the panel, so.
Thanks, James. So my name's Nicola Payne. I'm the Interim Programme Manager at Nottinghamshire Alliance Training Hub. And the thing that most excites me and why I like nursing is that there is no 2 days the same. And that was one of the things that I thought about going into nursing, that it would be such a varied career. And I know that Lisa mentioned literally the world is your oyster and you can go anywhere and do anything. You can travel all over the world once you've got that nursing qualification. And I think that there's such a vast array of professions that you can then go into as well, sort of academic university. So it's really is sort of a starting block for the rest of your career.
Amazing. Thank you so much, Nicola. And Caroline, you're a new face for us as well.
Hi, hello, my name's Caroline. I'm a practice nurse. I qualified about 2.5 years ago. Went straight into practice nursing. My main takeaway, I mean, practice nursing, obviously variety is fabulous. No 2 days are the same, as Nicola says. For me, it's the fact that you please go into practice nursing straight from university. Because for a long time, they advised that you go to hospital to work before you go into practice nursing. Just go straight into practice nursing would be my tip.
Super, thank you very much. Right, and Steph, you're another new face for us.
Hello everybody, my name is Steph. I'm the Training Hub Business Manager for Nottinghamshire Primary Care Setting. I'm a nurse by background and I've been nursing for 21 years. I can honestly say that through and throughout a nurse, and I've practiced in all of the settings, from primary care to secondary care to education, being a lecturer at university. And the world is really your oyster. I've continued my studies. I've done my master's. I'm currently studying my second PhD. So, you know, you can choose whatever you want to do, but I have to say the fondest memories I've got is from practice nursing. So please do go. It's a really safe bet to be in.
Wonderful. I entirely agree. Primary care is brilliant. Certainly fan. Right, we met everybody else, but we'll just go through people quickly. We'll start with Lisa. She was at first up, so we'll remind ourselves.
Hi, so I'm Lisa Freeman, as I said before. So I've been a qualified nurse for a very long time, since 1995. So I've worked in the UK, I've worked in Australia, I've worked in secondary care, and I'm now fairly settled in general practice as an advanced nurse practitioner. So I've done my master's. I'm currently doing a PG cert in clinical education and teaching. So even though I've been a nurse for a long time, the study carries on and it's exciting. And I can honestly say it's given me a really, really good life. And I've met lots of really interesting people and friends along the way.
Excellent. Thanks so much, Lisa. Who went next? It would have been Rebecca, I think.
Yeah, it was me. I would say what makes me want to be a nurse the most is just the ability to help people, the ability to help them change their lives. And I just think it's an absolute, I can't think of the word now, but that's what appeals to me the most.
Leaves you speechless. That's it. Imogen?
Hi everyone, I'm a third year student at the University of Lincoln, and the thing that I love the most about it is being able to build the relationship with the patient and their families and getting to know the person, not necessarily a diagnosis.
Amazing. Thank you, Imogen. Lucy?
Hi, I'm Lucy. I'm a practice nurse from Leicester. And the thing that's best about it is the patients. They're always a bit random. And when you get to know them, they teach you rather than you're teaching them to manage their health. It's brilliant. And you don't stop learning. You're always on courses, so it's really good. So I'm with the practice nurse crew, so go into practice nurse as soon as you qualify. So that's what I did, and I love it.
Excellent. And finally, Hannah.
So I'm Hannah. I'm a practice nurse in Lincolnshire. The thing that I absolutely love about nursing is caring for people of all ages and really becoming part of their trusted sort of family as such. So you're looking after the little babies all the way through to your 102-year-olds that are still farming. So
amazing. Well, we've got thank you so much, everyone. So just to give everyone just got a little reminder of who everybody is. Well, we've had an absolute avalanche of questions, and we're going to do our best to get through them. Now, the expected end time for this is around about 7:30. We might go on a little bit longer if there's still questions coming, if that's all right with people. But I appreciate that people have got evenings to get to. So this, as I said, this will be available online afterwards. So the first question, I think, so we'll start at the beginning. Quite a lot of people have been asking about A-levels and about how they might choose A-levels and the like to maximise the chance of getting into university. So what A-levels might they take? Are science A-levels essential? And what do people know about things like doing BTECs and the contributions they can get into doing nursing degree? Would anybody like to take that one?
So I can talk about sort of like the BTEC. So I think with any kind of variety of A-levels that you have, or sort of like other qualifications that you're wanting to consider, it's always worth speaking to the universities where you may want to apply to find out their sort of like fundamental requirements, because like I said at the start of the presentation, each university do make other considerations. If you've got something really fantastic to offer to that university as a student nurse, they definitely do consider other options. But the current students may be able to help more with kind of the A-levels and the choice that you need to get into with currently.
I would say that you should always choose the A-levels that you're most interested in, because it can be a really long 2 years. So yeah, pick wisely. And some universities do actually really like if you have like a really not traditional A-level. I mean, one of my friends, she actually did an A-level in art, and then she did a BTEC in combined science, and that was enough to get her onto the course in Lincoln. And they obviously liked that she had passions in other sectors, and she obviously shone through her personal statement that she made it clear that she wanted to be a nurse. So yeah, always contact the admissions department, see what's relevant, but don't let anybody tell you what choices to make. That's your decision.
Excellent. I mean, would our panel here suggest that if people are interested, they might take a science, or do you think it's not? It wouldn't be so helpful or so relevant? What do you think?
I don't think. Well, personally, I think social sciences are better for you more than the proper sciences that perhaps a medicine course would ask for. I didn't do the traditional sciences, so I don't know a massive amount of what they cover, but if that's what you like, go for it. Yeah.
Super, thanks, Imogen. Hannah, I think you had something you wanted to mention.
I was just going to say that it's because you're interested in nursing, you're probably interested in sciences anyway. They tend to go a little bit hand in hand. You've got a bit of an interest in the human body, and you like to know the sort of the social side of it as well with the social sciences. So it's not going to harm your application by doing science, but again, you don't have to do it. It's not essential to apply to university either, because they will look at other things as well.
Brilliant. And somebody's mentioned doing a health and social care A-level as well, and it sounds like that could be very relevant, especially if you kind of explain what you've learnt about it within your interview and in your personal statement. Do you think that's correct? Yeah, I'm getting some nods there. Wonderful. Right. So I'm just so lots of people have asked about the A-levels. So actually what I might do, because so many people have asked about it, just to ask our two students, what A-levels did you guys do? If you wouldn't mind answering that, Rebecca.
Yep, so I didn't do A-levels, I did the access course, but I will say on the access course what we do is biology, psychology and sociology, so that might be helpful.
Brilliant. And Imogen?
I did psychology, sociology and religious studies. We did a whole module in psychology about biopsychology, so I have a really good knowledge of the structure of the brain and how things in the central nervous system link up and control you to do stuff. So psychology is a good subject to choose because it links you with a lot of things and a lot of conditions that you might encounter with patients. And sociology is good because it allows you to understand, obviously, the society perspective of it, you know, poverty and sexuality and all things like that. So yeah, go for it.
Yeah, definitely. Psychology was great. I did psychology as well. A fascinating subject, isn't it? Right. Okay. Well, so I think that hopefully that's answered people's questions about A levels. Feel free to pop other questions through. We might have to answer them in email form, but we'll do our best. The next question, I suppose, is quite a tricky one, isn't it? So somebody's asked they've asked which is the best university for studying nursing. But what I might rephrase that as, how might one go about choosing a university to study nursing in? How might one go about exploring those options and then making a decision? Anybody like to jump in with that?
So I think I've said this previously, that you know, you have to look at what the university can offer to you. It may be that there's lots of, you know, you've got sort of like a passion outside of the course that you're going to do, whether that's sort of like music or sport. So it's to look at what that university can offer to you, not just about getting a place at any university. It has to suit. Do you want to live at home? So is it got to be a local university? You know, is it some kind of city elsewhere that really kind of, you know, attracts you to that? So I think there's lots of different options, and all universities offer really, really good open days. Even with the kind of current pandemic, lots of them have put really, really good virtual open days online, so you can access them and see all about the university. So there's lots of different ways of choosing. So it's very, very personal. And I could say that there's not one university that would be better to do nursing, because they all offer very, very different kinds of courses. Not different courses, but they offer different opportunities.
Super. Anybody else have any thoughts?
I'd second what Lisa says, that every university is different, and other things that you might want to look into is potentially how they grade you. So assignments, it might be that you've got written assignments, it could be that you've got what they call OSCEs, so where they observe you doing clinical skills. It could be that you've got presentations, or they may say to you, you need to go to a conference and show a poster. So each university will do a different style of assessment, and part of choosing a university is knowing what works well for you and what you'd like to achieve and how you want to do that. So that's definitely a key area to look into, as well as all the opportunities that Lisa mentioned.
I'd just also like to say that it's really important that you look at the area that the university cover in terms of placements, because if you don't have your own mode of transport, you could be having to move your residence. So some hospitals could be an hour away from the university, and you might have to move into the hospital accommodation. So I think you just need to consider that if you're looking to move away from home. That's a really big factor.
Brilliant, really helpful insight there. And I might ask one of those that's worked in the university, do nursing courses differ in the way that they're taught, or the sort of experience of teaching they have? Perhaps Nicola or Steph between different universities. Should come to Steph.
Yeah, sure. I'm originally trained in Portugal, so the beginning of my career was there, and that's where I taught the nursing degree, which in its structure is very different from England. Having said that, they all have the basic teaching modules. So we start with a generalist role, and within there's quite a big focus on nursing practice, but I think it might be perhaps a bit more wise to pass on for those who have experience in teaching nursing degree here. Also, I can say that I've got teaching experience here, teaching a nursing degree, but again, it's with the international overview of the nursing as a nursing practice and within the nursing professional scope.
Brilliant. Oh, thank you, Steph. Nicola, I suspect you've got some insight here as well.
Yeah, if I use Nottingham as an example, so the University of Nottingham, they've just recently changed their undergraduate nursing programme. So the first year nursing don't go out until the very end on placement, whereas the Nottingham Trent University, their undergraduates commenced in September and they've literally just gone out on placement in December during COVID. So locally different universities are starting to flex, but we all have to follow the same sort of learning outcomes and things through the NMC. So we all have to complete the same number of practice hours and theory hours.
Brilliant. And I suspect there are probably differences between universities, you know, outside the East Midlands as well. And it's worth kind of really exploring the university sort of structure and the university courses as you're trying to make that decision. Talking about making decisions, somebody's asked, they want to do a career in science, but unsure whether they want to become a doctor or become a nurse. Can they differentiate between the two or highlight how much they cross over and what made us to choose to become a nurse over a doctor? Hopefully I can answer the doctor bit of that. So I'll start and then anybody can jump in. So I think that I'm currently a GP. When I was looking at sort of applying for universities, I realized that as this person has as well, I realized I wanted to do something in science, but it was about, I think it was about exploring what about it made me particularly interested. And I quite like finding out about disease, and I quite like finding out about how things work and how the body works. And that's what sort of drove me, and sort of exploring around that profession. That's how I sort of found out I wanted to be a doctor. But I certainly considered nursing as well, because the care aspect of things and the kind of integration with people's lives were really, really appealing to me as well. So that's sort of how I approached that decision and my exploration into it. Does anybody have any sort of insights on how they figured out that they wanted to go into nursing? Because I know everybody here's, I think, been very passionate, and I maybe come to our some of our student nurses who did things before applying.
Yeah, so with me, I think, like, it was my grandma's influence. She had a big influence on me because she always said that I should be a nurse. But then obviously I brushed that aside. But I think working in the care home, it really drove it home that it really was something that I thought I would be really good at, and I thought I'd really enjoy.
Amazing. Thank you. Anybody else want to share why that? Hannah?
Yeah, so I was in a fairly similar situation where I was debating between applying for medicine and applying for nursing. And what I did was I spent some time doing work experience in a GP surgery and worked with both nurses and with doctors. And I still was unsure, so I applied for both for university anyway. And it just so happened that I didn't get any medicine offers and fell into nursing through that way. But actually, I wouldn't look back. I've now discovered that for me personally, I much prefer the way that nurses are taught, very much of a hands-on approach, and that is me down to the ground. I like to get stuck in and have a go at things. And there's still the opportunities in nursing, and I'm a bit biased, I know, because I'm a nurse, but the opportunities are still there to develop, to do your prescribing and to develop those extra skills where you can diagnose and things and become an advanced practitioner. So it's really down to how you feel as a person, and it's a very, very personal choice, but I'm biased towards nursing.
I think there was the person asked whether there was lots of overlap, and there's a huge amount of overlap. And I think that as people are, you know, exploring their careers, especially in nursing as well, the avenues that you can go down, the aspects that you can explore to prescribing and independent practice are exploding. So I think it's it's one of the most exciting times to be a nurse right now, and I hopefully our panel would agree with that. So many things that you're going to go into. So you mentioned work experience there, Hannah, which brings me on very neatly to a question which a lot of people have asked. One would be, how much is it work experience and experience of healthcare important in the run-up to applying? And secondly, in this current odd situation that we're in at the moment, has anybody got any suggestions of how people might get work experience or things like work experience to help their application? Would anybody like to jump in with that tricky one?
So I'd say work experience is essential in some sort of aspect, so that you know what you're applying for. You know, you need to know what the role of a nurse is and what that all entails. Otherwise, you'll be a bit of a rabbit in the headlights when you first start the course. In COVID times, it's a little bit trickier, but there are opportunities out there. So it's talking to your local services, and it may well be that you've got some virtual opportunities, so they may allow you to sit in some training elements that they do for patients. So, for example, they can have diabetes prevention programs and things that they may allow you to sit in on. It could be that you can go and support some local gym sessions that are being run. In Lincolnshire, we've got 1U Lincolnshire. I'm sure there's similar in other counties around the place where they do sort of health and lifestyle advice, and they'd allow you to sit on the virtual sessions that they're doing for those. So the opportunities are there. It's just a little bit more trickier in COVID times, but if you contact training hubs and local people, then we'd be able to direct you in the right place.
Brilliant. Has anybody else got any top tips for getting work experience at the moment? Nicola?
I was just going to say that this opportunity, and we all get sent a certificate, those that have attended tonight. So it's seeking out unique opportunities, and because it is COVID and it is difficult, universities do recognise that, and that you don't have the same opportunities as others have in previous cohorts. So seeking out, as Hannah said, opportunities and contacting training hubs. I know that I've done some careers chats with students who have been applying to university, and that's been taken as sort of a work experience, going to find information.
Excellent.
Also, there are other organisations. So, for example, the St John Ambulance or the Red Cross. So they're really good because obviously they teach you basic first aid. They probably will be helping out in terms of the COVID stuff as well at the moment. And equally, they sort of obviously they would be going out to events and things and actually supporting events, doing first aid cover. So you'd actually get used to sort of working with patients and other people that would come into contact with you that you need to treat. So those are all good things. And like I said, those organisations are still going despite COVID, and they probably will be helping out in COVID. So certainly consider them.
Brilliant. Thank you. Well,
Somebody's just put in the chat, James, that somebody's doing some work experience with Brighton and Sussex Medical School, that it's very easy to access if anyone was interested in accessing that. So that's really helpful to share that. Thanks, Maria.
Yeah, thank you very much, Maria. I mean, if we could ask you to send perhaps send the details to one of the training hub's email address, that'd be a really great thing that we might share with others. So thank you very much. And while we've got you on, Lisa, so we're just sort of doubling back slightly, just talking about getting into work experience. Somebody's asked, what would be the best way to get to nursing after secondary school? Do you have to do A-levels, or are there other routes into nursing? And particularly, some people have asked about apprenticeships and the routes in. Would you like to take part of that question?
Yeah, so there are different options. So there's one apprenticeship route, which is a nursing associate route. So with that, it's a level 5 sort of like course, so a foundation degree course. And if you wanted, once on completion of that, you could then go on to do your registered nursing. There are nursing apprenticeship routes, so not directly sort of like through the A-level route. So it's worth speaking to sort of like universities again, or sort of like colleges that would be able to help with sort of like your specific requirements of the routes that you want to do to get you into nursing, if that's what you definitely know that you want to do.
Excellent. And how are the apprenticeships and things like this sort of evolving going forwards? I know there's lots of work going on through healthcare apprenticeships, even for people doing the degree. Would anybody like to explain about that work that's going on at the moment?
Hi. Yes. So for example, in Lincoln Hospital, or so there are 3 hospitals across Lincolnshire. They actually directly recruit healthcare assistants to into work. So they would be working typically 3 days or the equivalent of 3 days worth of hours in work. in hospital, and then they would attend one day in university, and then one day be it on placement or insight visits. So it's sort of a bit more of a flexible scheme. Obviously, you would also be paid a salary as well. So that is an alternative way to go into nursing. And as Lisa says, there is then the opportunity to do a top-up course to become a registered nurse as well.
And I think that these opportunities are expanding quite a lot at the moment. So definitely keep your eyes peeled, because I think it's become more and more often, and there are apprenticeship routes into all kinds of things, and looking for things like medicine as well as paramedicing and all this kind of stuff via the apprenticeship routes. That gives people the opportunity to earn money as they train, although it may be sometimes a slightly longer course, but again, it differs from university to university. So worth exploring that if that sounds like it's an attractive option for you. Brilliant. So people, please keep the questions coming. We've got a little while left, so feel free to pop them in the chat. So I want to move on to the actual experience of being in nursing school. And so somebody's asked here, do the universities, what do the university courses actually go through? Is there a lot of science and anatomy, or is it more about specific care aspects of caring for a patient? And how's that delivered? Is it in lectures, or is it in placements? Is it a mixture? Or what's people's experience of those things?
Okay, that's all right.
Imogen first.
Like I said, it's 50-50, and when you're at university, it's hard to say because of COVID times now. You can't really say exactly what we're doing. But generally we'll be in one day a week doing the practical skills, learning how to do a bed bath and insert cannulas and all of what you would describe as caregiving. I think that's what you mean by that. And then another day we'll be doing the lectures and seminars and things, discussing the theory behind it, talking about like Maslow's hierarchy of needs and all of the research behind everything, because there's a big push on evidence-based practice nowadays. So you really have to understand why you're giving the care you are and the techniques. I think that answers the question, I think.
Thank you very much. And Rebecca, do you have anything to add?
No, not really. So I'm only 8 weeks in at the moment, 8 weeks worth of teaching. But no, I would agree. It's we've done the practical 1 day a week. So like Imogen said, that's the practical stuff, basically the caregiving, and then we are doing the theory. So we've just handed in 2 assignments. One was on the fundamentals of care, of nursing. So it was things such as homeostasis and stuff like that. And the other one was on interprofessional working. So we had to do a lot of research around interprofessional working, which also there's a huge push on at the moment. So yeah, so far that's what we've done.
Now, that human contact aspect of things are really important. So somebody's asked here, how does that sort of split up? How much of the course might be practical skills learning, placements, and academic, sort of lecture based? What do you reckon? What's the kind of the mix for the universities?
So I think I said in my talk, I think I said 3,700, but it's 3,400 hours that the Nursing Midwifery Council asks for each element, the practical and the theory side. So I've forgotten the question now. Sorry, can you say that again?
And what do you think the mix of practical placements and academics, is sort of like more like lecture book learning, is for your course? Okay,
so the way that Lincoln teaches is that generally everything we learn in theory we can apply to practice. So everything is relevant, and they do it in what they call a spiral curriculum. So the things that we'll learn in the first year, we just build on each year. So we're covering sort of the same information, but thinking differently. And you can really see that. So what Rebecca might be learning now, I can talk to her about and will understand, but I will understand it a bit of a better knowledge and engagement with people and put that experience together. Yeah.
Sort of like a spiral curriculum. So you're working, you learn a little bit more, and then you build up and build up. Yeah. And I think, as we mentioned earlier, I think it'll be slightly different from university to university about that mix and the way that they the way that they put that in. So earlier as well, somebody asked, what's it like being a student on placement? So I think it's going to be a little bit tricky for Rebecca to answer because she's only had 8 weeks and it's been during COVID. But for those qualified nurses and for Imogen, who's been a third year, what's it like being a student on placement? So where would you go? What's your day like?
So I'm on my 5th placement. So I have had a placement in gynecology. I've had a placement in endocrine and gastroenterology. Then I've had a placement in a doctor's surgery and a placement in a minor injuries and illness centre. And I am currently on a community ward, and it's got an end of life sort of hospice element to it. And then my management that I'll start in April, I'll be with my community team that my job's at. So a very vast area, and that's the thing with the nursing. It's not necessarily just on the wards nowadays. You can go anywhere. And unfortunately, I missed out on my elective. I was supposed to go to a specialist hospital and a hospice for that, but COVID stopped that. So you really can go anywhere with it. It's brilliant.
Do you get to choose those placements?
You do get to choose your electives. As long as the place is willing to accept you. I know places like Workload can help you. It is all self-funded, but you can go absolutely anywhere. Some friends of mine were going to Mexico and things, but it is a real shame that we did miss out on that.
Yeah.
So.
In the hospital, can you choose your placements, or are you sort of scattered around?
No, you can't choose. Well, Lincoln, you can't choose your placements. You can directly swap with someone. So if you've been allocated a placement at Lincoln on the stroke ward and someone's got the stroke ward at Grantham, you can swap as long as you're both happy to do that. But you do have to cover all the different elements of nursing. Yeah.
Brilliant. Excellent. Thank you. And I suppose again, so when you're in a ward or in these situations, how does that sort of work? What's your experience of being on that placement? Again, I'm afraid it's probably you again, Imogen.
So my experience has varied as time's gone on. Obviously, the first placement was very much, I'd never worked in a hospital before at all, so I worked a lot with the healthcare support workers, learning the fundamental caregiving, so giving the bed baths, making the beds, feeding people, assisting dementia patients, anything like that. And as time's gone on, you do develop those leadership and management skills. So now I'll perhaps be liaising with other healthcare professionals, with the doctors, going to MDT meetings, helping give drugs out. You can really do anything. It depends on where you are. Some places will perhaps let you assist with minor surgeries. I know some of my friends have been at cardiac arrests and have been helping with that, so it really depends on the placement what you could do, but you such a variety of skills working with lots of different professionals.
Brilliant. So there's been a question come in which I suspect is a bit tricky, but I'll put this towards the whole audience here. The one is, are nurses constantly under pressure? And then secondly is, how demanding is the nursing profession? So they're very honest sort of questions there, maybe a little bit tricky to answer. Steph, evidently you've been a nurse for a really long time. How do you answer those questions?
There is the honest answer is there is always pressure in a way that you would want to provide the best care possible for your patients. And I'm a perfectionist, so I put additional pressure on the pressure and additional pressure on myself to deliver the best I can with what I've got in order to achieve the best outcome. So I guess it will depend very much as well on the type of person you are, what makes you tick, what you're aiming for, what you naturally would prefer certain areas over others, and that's when you try and discover what sort of nurse you will be and you'll develop in. But there's always pressure, you know, if it's not from the time pressure, is from staff pressure, is resources pressure, and then there's your own pressure in wanting to do the best you can. And I guess I suppose is to how you cope with that and how you deal with it. But you know, there's pressure in life as well, so it's about balancing that and making sure that you look after yourself so that you can look after others as well.
Brilliant, thank you. Very honest answer. Thank you so much, Steph. I mean, so Lucy, maybe I'll put the other question to you is, how demanding do you find working as a nurse? How demanding is the nursing profession?
Well, any job's going to be demanding if it's something that you're really passionate about. I think you can have demanding times in any sector, in any job. But like Steph said, it's the way you deal with it, like trying not to take any of it home, and the support you've got around you, talking to colleagues if you're under pressure, and finding ways of finding solutions to why you're under pressure. I know staffing and things can't be helped, but there might be alternative ways, and as long as you're at a good place, either at a good practice or on a good ward, then the whole team should work together to try and relieve some of those pressures. And with working as a team wherever you are, it makes it a little bit easier, because you're always going to have a bit of pressure, but it's just about managing it and dealing with it best you can.
Excellent, thank you very much. I think there's lots of, it means these things sort of mean different things to different people. Has anybody got any other thoughts they want about how challenging or demanding the role could be, and about how they approach that? Hannah?
I just wanted to say, even though you've got the pressures that come with nursing, actually you'll find in healthcare that you've got an amazing team around you, and that massively lifts the pressures. So when you come into a healthcare sort of profession and a work, you develop friends that are friends for life, and you develop a very strange sense of humour, just to help you get through the day. So yes, you have pressures, but there's the support mechanisms around you. You've got really good colleagues. You have ways that you can de-stress. So you may have clinical supervision. It may be that you decide that you like to bake 1 million cakes to bring in, and everyone enjoys them at lunchtime, don't they? Or it might be that you go for a walk or something. So it's all about work-life balance, and making sure that it's a pressure that you enjoy and get the most out of.
Brilliant. And a couple of people have asked how people find studying and dealing with the pressure and that. Have you found, Imogen and Rebecca, have you found the workload particularly heavy, particularly Rebecca, in your first 8 weeks in this odd kind of situation? How have you found that and kind of balancing workload?
Yeah, so currently, obviously, most of our lectures, all of our lectures and seminars are online. I've personally, and I know a lot of other students have as well, found it hard to self-motivate. And because it's all online, you're at home, you get so distracted by other things. But there is a lot more work than I thought there would be. Yeah, there is. And the workload is large. And it's the transition that you make from directed learning to self-directed learning. I think that's the most challenging thing. So you've got to go away, you've got to research things yourself and really educate yourself on things. But yeah, slowly but surely we're all getting used to it, and obviously throughout the 3 years it will become more and more normal for us. I don't know if it'll become easier, but it'll become normal. But yeah, so far we have, I think all of us have been quite shocked by the workload.
Was that a similar experience for yourself, Imogen?
Yeah, I agree with Rebecca that doing a degree online is very hard to motivate yourself. I don't know what it is, you just can't engage as much as what you would with other people. But please don't let that put you off applying, because perhaps by the time you do get started, things hopefully will be back to normal and we'll be able to see each other face to face. The workload is a lot. I mean, going straight from A levels to a degree was, I don't want to say easier, because it wasn't, but because I was already in that academic mindset, I didn't really stop. But it's a lot of reading around the subject. They say that you read your way through a degree, and it's definitely true. And what you put into it is definitely what is reflected in your grades. Like I said, level 6 writing is hard for somebody who's not necessarily academically gifted, but the university should have a lot of support for you. And if you fail an assignment, there generally is always another chance for you to resit that and to have another go. And whatever happens, they'll be able to support you because they want you to pass. So yeah, there should be no reason, if you really, really want to be a nurse, that you would not pass. You should pass with flying colours, really.
And someone's mentioned about getting mentorship or sort of support during a degree. Is that something that's been easy to find? I suppose you have a mentor on the placements and the practice that you have, and like a supervisor.
So it's sort of changed halfway through, I've been learning, because the NMC released new standards. So we used to have a mentor, which is who we would work with solely on placement, really, or 40% was supposed to be. But since last year, we now have what we call a practice supervisor and a practice assessor to remove the bias of somebody, because you have to do an assessment while you're on placement. A practical skill, you can do anything. But they assess you, and then you work with all the other nurses and healthcare professionals, and they give feedback to your assessor. So you should be okay. I mean, you should be allocated a personal tutor at university that you can contact anytime if you have any problems. There's a student wellbeing support that's really good, really easy to access. I've accessed it, and they give you all the support that you need. You can have counselling, you can just go for a chat. So you will be fully supported throughout your degree because you're paying for it, so you should be.
Brilliant. That's really good to hear. And I know lots of universities offer pastoral support as well, and you can integrate with the other students as well. Somebody's actually asked about that, how one goes about balancing social life and university life, and whether education or whether placements get in the way of that, or how you manage it.
Gosh, I feel like I'm answering all the questions tonight. So you can definitely have a social life. I mean, we haven't really been out much in the last 9 months, so that's hard to comment on. But while I was living in halls, I went out every night in Freshers Week, and I still had lectures in the morning, so you can definitely do it.
Yeah, I remember that one.
Yeah. I mean, I'm on track for a first, so hopefully I do get that at the end of the year. Just utilise everything they give you, and you'll be absolutely fine. You know, I work all weekend, and we still have to do 40 hours of placement, so it can be quite demanding, and getting 8 hours sleep can sometimes be a bit of a struggle. But you'll get holidays, so that's okay. It's not all bad. I'm glad I'm on Christmas holiday.
Thank you. Right, well, I think we were getting to the end of our questions. There's been a couple about getting into paediatric or mental health nursing. So does anybody want to just expand about sort of the differences in application for those things, about how one goes about applying for them? Did anybody think about applying for paediatric or mental health nursing at the beginning of this?
I think most universities are in the same kind of situation, that they offer smaller amounts of sort of like specialist training, sort of like i.e. paediatrics and mental health, and certainly learning disabilities. And the biggest kinds of places on offer are adult nursing. But even if you do adult nursing, there are always opportunities sort of like in other sort of like specialist areas. I mean, I have a third year student on placement with me currently, and she's already been offered a job as a newly qualified registered nurse within paediatrics, and she hopes to go on and do her specialist training in paediatrics that way. So it's always worth a thought if you can't get your first choice of mental health or paediatrics, to go and do the adult option and then do your extra learning as a fully qualified registered nurse.
Excellent. Thank you so much. And there are lots of information available about those other options as well, online as well. Hopefully we're going to produce some materials to help guide people in those directions as well, because it's a question that we've been asked a couple of times as well. So I think, so as we approach the end of this, what I like to do is just ask our panel for just a kind of just one or two lines about what, if they were to give you one bit of advice, our sort of budding nurses going forwards, if they were to give you one bit of advice, what would that be? Okay, so when it comes to each person in turn, one bit of advice or inspiration about their future career in nursing and bringing you into this this wonderful profession, what would that be? And give everybody a second to think about it. And during that second, I would like to really encourage everybody to do the feedback. So that's going to go up. I'm going to pop that in the chat. And it's going to be on Menti as well. Now, the best Christmas gift you could give to us today is the feedback, because that enables us to find out what we did well, what could have been better, what would you like to hear more of, what would you like to hear less of. And so we can bring you more events like this in the future, so that we can offer you the support that we need to, so you can reach out to us via our email addresses. But please, please, please fill in the feedback form. It's on Menti. So you can click on that link, or you can go to the number 4930 682, or slightly less confusingly, 4930682. That's on menti.com. It's so helpful. It's super invaluable, and it will help us enormously. So now that our nurses have had a chance to have a little think, let's go for it. So I'm going to start at the top. So I'm going to go with Hannah.
Well, it's tricky going first. So I would say, just if you have the passion to go into nursing, then let it shine through. So it can be challenging at times. It can be really, really rewarding as well. So just let your passion shine through in your applications towards your nursing, and let it shine through in your career as well, so that you're able to do the best that you can for both patients and staff as well.
Amazing. Thank you, Hannah. Lisa, you're next to my screen.
Yeah, so I would just say work hard, play hard. And sort of like the biggest sort of like advantage of sort of like going into nursing, obviously we've seen with the current pandemic sort of like the invaluable resource that nurses are. And if you do become a registered nurse, you will never, ever be unemployed.
Excellent. Thank you so much, Lisa. Right, Imogen.
I would say, if you're really considering about it, but a bit worried if you have the skills or the capabilities, just do it. You won't look back. You know, everybody self-doubts themselves, or can I do it? Have I got the skills? But I think you should just do it. You'll never regret it.
Amazing. Thank you. Rebecca.
Yeah, so my advice is actually quite similar to Imogen's. If you're on the fence, if you think, oh, maybe I should do something else, if you're not sure about the workload or whatever, just go for it, just do it. I mean, the worst that can happen is that you hate it and then you go on to do something else. It's just do it, just give it a go.
Thank you so much. Lucy.
My advice is the training can seem really hard. Stick with it, and it's well worth it in the end, and you'll enjoy it. You'll look back and think the training was easy.
Excellent. Thanks. Steph.
I would say never look back. Just grab it with your both hands, everything. Give it your best and put your heart into it. You don't really need to have your decision now on what you want to end your career. Nursing has that wonderful opportunity of, you know, that offers you all the opportunities in many and multiple different settings. So you don't have to have that decision for now, but just don't let it go, because nursing is really, really a rewarding career.
Thank you so much. Caroline.
So echoing everybody else, really, nursing isn't just for Christmas. It's for life. If you want to do it, go for it. And as Rebecca said, you know, if you go and you've made the wrong decision, give it a go. If you want to leave, but at least you've tried to see whether it is for you, and you may well find it is for you, because, you know, there's so much out there nursing wise. Go for it.
Excellent. And finally, Nicola.
I'm trying to find some new words to say now that everyone's gone. But I think for me, it would be to challenge yourself. And although you'll feel nervous a lot of the time during your training, new placements, new faces, new teams, that's a good part of it. And that taking those opportunities to feel nervous helps you build your confidence.
Excellent. Very wise words there from our panel. So with that, I think that brings us to the end of today's talk. We really hope you've enjoyed this. Hopefully this has been helpful and has helped enthuse, inspire, informed and link you into the fabulous world that is nursing. We're here to help you as the training hubs. Please contact us if there's anything you'd like to explore, or maybe we can point you in the right direction. There's been so much information in this. It is going to go up on YouTube, so keep your eyes peeled over the next few days. You can also follow us all on Twitter as well, and we do lots of stuff with reaching out to schools and about workforce and all this kind of stuff, and about, you know, find out about the world of healthcare. As I said, the feedback is super important. It helps us so much, but apart from that, I'd just like to say happy Christmas, and hope it's going to be a slightly unusual one, but I hope it's going to be a really good one. I hope you have a lovely couple of weeks if you're off, or no matter what you're doing, and good luck with the application if you make it in January. But thank you very much. Good night. Thank you to all the panelists, and thank you to you guys for coming. Take care. Bye.